My name is Gary Nolan. I'm the CEO of an organization called Collab Health, where we work very hard to foster stronger relationships between healthcare professionals, patients, and the pharmaceutical industry. So today's session is actually called Assertiveness is not aggression, and accessible strategies to advocate for quality care. So this session actually is a direct result of a previous session of the Advocacy Exchange, where we heard from Mark Bertoloni, the CEO of Aetna, where we heard a remarkable story of how Mark advocated for his son, became an expert in his son's condition, went to incredible lengths to find alternative treatment options, care options for his son. And we heard how he navigated that journey over the course of several years and continues to do so. But not all of us have the time, the skills, the resource of a CEO or someone like Mark. So what we're going to discuss today is alternative approaches or methods that can be used to advocate for yourself. And just to provide some context to this, as I said, not all of us have the necessarily the skills, the time, or the resources that Mark has or had available to him. But one thing that we do all do in our day-to-day lives or our professional lives is we validate decisions. To give an example, if our car was to break down, the first thing we would tend to do is take it to a garage and get an opinion on what needs to be done to fix our car. If that opinion was expensive or you're unsure of it, we would go get a second opinion. We would speak to another mechanic and we'd get a cost and we'd get an approach to fix our car. And what we're essentially doing there is validating a decision making. And we do this every day without even knowing how we've done it or why we've done it, but we're constantly validating decisions in our day-to-day lives. So in this session, we're going to hear from 4 speakers who are going to share their personal experiences, how they advocated for themselves. We're joined by 2 patients and 2 carers, and they're going to be sharing some techniques and approaches that benefited them through their journey. What's exciting about this discussion is that there is no right or wrong. Their experience is their experience, and their approach is their approach, and it worked for them. It may not work for you, but it worked for them. So we're going to hear some really exciting insights into how they validated their journey, how they advocated for themselves, and how they have got from where they were to where they are now, to the point where they're here to share their experiences with you. So I'd like to take this opportunity to introduce our 4 panelists, or actually ask them to introduce themselves. If it would be great if I could invite our first panelist, Megan Claire Chase, just to give us 3 or 4 minutes background to her journey and why this topic is important to you, Megan Claire.
All right. Well, hello, everyone. I first want to say this is typically not part of my outfit here. I have a heating pad on. Just got diagnosed with an injury yesterday, so just know that I made it part of the outfit today. So like Gary said, I'm Megan Claire Chase from Atlanta, and many in the cancer community know me as Warrior Megsy. I was diagnosed 2 months after my 39th birthday in September of 2015 with stage 2A invasive lobular breast cancer. I had to constantly advocate for myself for over 2 years before my symptoms were even taken seriously. It wasn't until I felt something in my left breast that my medical team finally listened. Since I was diagnosed under 40, I was classified as an adolescent and young adult, also called AYA. My rise in advocacy was very organic, and it started with my blog, Life on a Cancer Train, because I don't sugarcoat my experiences. It's that raw honesty mixed with some humor and sarcasm that really resonates with many in the cancer community. My blog followers are from all over the world, and it's read in over 70 countries. and I'm very involved in the young adult cancer community, including Stupid Cancer, Elephants and Tea, and Cactus Cancer Society. I've been a guest on numerous podcasts, including the latest ones, Out of Patient with Matthew Zachary, and The Burn with April Stearns from Wildfire Magazine. And I'm also a freelance writer for WebMD under their breast cancer section, and a research advocate and consumer reviewer of the latest research proposals for the Department of Defense Breast Cancer Research Program. And I've been a panelist and guest speaker for a number of events and conferences, and I've been featured in the New York Times, People Magazine, Farmer Forum in the UK, and more. So for me, today's topic is extremely important because being assertive became necessary from me trying to get diagnosed, then during my active treatment, and now in my so-called survivorship stage. It can be uncomfortable and exhausting having to continuously advocate for myself. My ultimate goal is to empower patients and let them know that it's their patient right to ask questions, to get a second opinion, stay current on latest research. And I also want to continue to shine a spotlight on the serious gaps from the difficulty of being diagnosed due to a young age, the struggles of getting tests covered by health insurance companies, financial toxicity, racial bias, and structural racism within healthcare, and push for real change and impact.
Thank you, Megan Claire. Welcome. So I'd like to jump to Kelly Cuvar, now our second patient representative today.
Sure. I was diagnosed with a rare set of tumors in 1999 in Cincinnati, Ohio. I was 19 years old, and I was a child, basically. I had the tremendous and great good luck of having a physician who led me through most all of it and told me all the hospital secrets and all of the inside information. He did not want this teenager to get rolled, right? He did not want that to happen. So I've been telling every cancer patient I've met since all of those secrets. From 19, I graduated from college and moved to New York City to go to Sloan Kettering, basically for a trial, and also because I wanted to live in New York. About 10 years later, as the Affordable Care Act came up and Obama was elected, I formed a political action committee in order to lobby Congress for the public option. Then this organization is still extant. I'm on the board of directors, but since then, my advocacy has led me straight to Capitol Hill, where I work for members of Congress who support Medicare for all. And my work has been in DC in the last few years doing that. I've been in Time Magazine. I've been interviewed live on CNN. I testified in front of a congressional committee about health insurance abuses in 2010, in the days leading up to the passage of the Affordable Care Act. I have never been in remission. I've been in treatment almost constantly for 23 years. And my advocacy has changed over the years, and my relationship to my disease has changed over the years, which I'm sure we'll get into a little bit of that. But thank you so much for having me.
Welcome, Kelly. And we look forward to hearing your personal professional experience as we go throughout the talk. I'd also like to now take an opportunity to introduce ask our first carer speaker, Colin Ferro, to introduce himself.
Thanks, Gary. Hello, everybody. So my name is Colin Ferro. I have been a caregiver within the cancer space, I should say, since my brother's diagnosis back in 2007 of testicular cancer. And it was during the time in which he and I were in college out here in Denver, Colorado. And so it's just the two of us away from home. And, as we're in school, trying to have the joys of college, maybe, a few too many social activities, a few too many, things in our hands, maybe. Schools are top priority is what I'm saying. My mom, you'll meet next. But, in all seriousness, it threw our college experience for a loop. My brother was a senior at the time, and, so it was what now? And then he graduated from college. And again, what now? Everybody's getting ready to move on with their lives, and he's trying to figure out, how to get a life started, balancing the thought of cancer treatments, etc. And so, I always say my role as a brother supporting as a caregiver, where he and I were living together, was more on the emotional side. My role was strictly emotional. There's so many different ways when it comes to caregiving, from emotional support to financial support to, obviously nutrition, etc. But I was a lot of the emotional side. And since then, I have transitioned to being an advocate for the cancer community. I got involved with some other organizations, and then asked my mom, who you'll meet soon, for a job back in 2014. And I have been working with Epic Experience ever since. Epic Experience mission is to empower adult cancer survivors and thrivers to live beyond cancer. That includes programs we've done for caregivers as well. But, really it's just about making sure we can be there for one another. And so compassion, support, and shared perspectives to where we can all get through this, thing called cancer. And that is my role. I'm the director of programs at Epic Experience, but a lot of times it's just listening and talking to folks and being there. So thank you very much for having me.
Thank you, Colin. And as Colin mentioned, we're lucky enough to be joined by two Ferros. So I would like to take this opportunity to ask Nancy Ferro to introduce herself.
Thanks, Gary. Thanks all for being here. It's an amazing thing to think about. A lot of times, if I've gone out and shared the story of Epic Experience, I usually start out, I'm just a mom whose son had cancer. I had no plans of starting a nonprofit, but in 2007, Colin shared Michael was diagnosed. He's my oldest of 3 children with testicular cancer. And to say the least, it rocked our world. No parent ever wants to think of their child having cancer. 6 months before that, he had been diagnosed with a benign brain tumor where the first surgeon wanted to drill into his skull. And at the time I was living in California, and I was like, do not touch him. And I immediately just started researching, and we'll get into that, for second opinions. Michael never had his skull drilled into, nonetheless, which was a good thing. And I'm sure we'll dabble into that a little bit more. But watching my son go through cancer was horrendous. And afterwards, after his treatment, is when it really got bad. Emotionally, psychologically, depression was just a miserable thing to watch as a mom. So in 2012, Michael was diagnosed in 2007. In 2012, I, with the help of an incredible couple, Mark and Amy Wilhelm, who own an incredible ranch in Colorado, said, you can use it. And we started Epic Experience and offering week-long outdoor adventure camps for adult cancer survivors. And we have done one caregiver camp, and that was an exciting thing to do. But since then, we've added many more new programs for caregivers. So my road to get here was because of my son. We often say he's the reason for the season, and he is the reason Epic Experience started. I've known many people in my life that have had cancer. I know many people that, we don't like to, lost their battle. Is it a battle? These are all words to think about. What are the right words? But I am so grateful for every single person I've met in the last 10 years. We've been around 10 years, and I'm thrilled to be here today to share a little bit of my thoughts and insights.
Wonderful. Thank you, Nancy. And thank you, Colin, Kellen, and Megan Claire as well. So we're going to jump into our first discussion, where we're going to look at what's been titled the vulnerability side of things. So the first discussion point, Megan Claire and Kelly, what we'd like to gain your experiences on Advocacy starts at the first sign, symptom, or diagnosis, and at a time when you are quite possibly at your most vulnerable, or not. How did you find it in yourselves during that period to empower yourselves to, ask the right questions, give yourself the confidence to speak up, and seek, information that wasn't available to you? Meg and Claire, if we can go to you first.
So, as I mentioned in my introduction, it took me over 2 years before my symptoms were even taken seriously. And my maternal grandmother, my Nana, she just always taught our family that it's our patient right to ask questions and to not feel bad for being pushy. So even though I'm definitely a naturally vocal person, it is intimidating once you become a patient. And so, after my diagnosis, things moved very quickly with my treatment. But I do remember that first visit with my oncologist. And I had done my research on her beforehand, and I had an idea of some basic questions I wanted to ask during that first visit, but it was also extremely overwhelming. So though I had my brilliant mother with me, who also has a rare blood cancer, I did have my top 5 questions and or concerns typed out because I'm just a naturally organized planner. But things became really complicated. And this is where I really felt even more vulnerable at first. But then when I spoke to my oncologist about the severity of my side effects, I had a lot of side effects that were never told to me. And then I was told, oh, well, just get off medicine for 2 weeks and then get back on it. And I'm thinking to myself, I can't be on this for 10 years. What are you talking about? And so when she kept dismissing my concerns, instead of feeling vulnerable, like I was in the beginning, because in the beginning, during active treatment, I felt like, I was being taken care of. I felt like things were going in the right direction. And it wasn't until I, made it to the so-called survivorship stage that I was like, wait a minute, something's not right here. And instead of feeling vulnerable, I became frustrated and determined. And I really felt empowered because I'm like, oh my gosh, I'm still alive here. I have to start speaking up even more so I can stay alive. And after a few more issues, I actually met with my oncologist one last time to say to her face that I am divorcing her, and here are my reasons why. And I felt it was really important to let her know that I kept advocating for myself and she was not listening to me. And I was like, I feel she needs to know that as a patient, that's hurtful. And so was that hard? Yes. Was it heartbreaking? Yes, because I felt like she had saved my life. She had brought me to this moment. And was it necessary? Absolutely, yes. So it's like I said, I wanted to take this opportunity to thank you for my life, but I need an oncologist who values my quality of life now. And that was a huge, I feel, huge turning point for me. And being empowered to really advocate for myself, to actually change not only oncologists, I changed the whole entire practice. I divorced that practice and it was really painful, but it was a big turning point for me in my advocacy.
Thank you, Meg and Claire. And the same question, Kelly, your experiences, please.
The day I was diagnosed in 1990, it was a different world in 1999. The internet did not exist as it does now. It was not easy to research. My tumors are so rare that it's not even easy to research them online these days. So I don't. There was never one second in my life as from the moment of my diagnosis until now that I ever held back and did not discuss what needed to be discussed with my physician. If my physician didn't like it, I would get another physician. I have been in trials in Texas at MD Anderson, at Sloan Kettering, at Dana-Farber, at Johns Hopkins. So I have a stable of oncologists, and sometimes you need a certain one to kick a certain door down for a certain reason, and you call on them. But I was lucky, my surgeon, I was diagnosed by a pancreatic cancer surgeon. I think most of you have probably been diagnosed by a medical oncologist. It was kind of, it's a different approach that a surgeon takes, but I was lucky. He empowered me from the second he met me. This was in Cincinnati in 1999. He moved to San Diego in about 2007, but he told me, I will always be your doctor. And he has come through for me. I consult him still. I haven't seen him in person in something like 18 years, and I speak to him about yearly. He is probably the reason that I am alive, because he acknowledged my stubbornness. A lot of doctors don't. And he worked with it. From that moment, I never, ever doubted that I was the center of what was going on, and I made all the decisions, and no one did anything to me without my express permission, and no one touched me without my express permission. I was a 19-year-old woman. No one. This doctor, the surgeon, actually came through for me. I think one time a resident told me, "Oh, you'll never be a swimsuit model. I have my tumors are in my right leg. I have a lot of surgeries done." And I mentioned it to the attending, and I never saw another resident again. And I don't know how that resident turned out, but I'm sure he got eviscerated for that. I don't know if I was lucky to be diagnosed by someone who worked with me on that level. It doesn't always happen, and I have definitely yelled in doctors' offices, and I don't have any problem speaking up for myself in any situation. I encourage everyone to always protect themselves with their words and find physicians who acknowledge that and honor it.
Thank you, Kelly. Great intro. So we're now going to jump to our two carers, Colin and Nancy. And what we'd like to share is how did it affect you as a caregiver to see your brother and son so vulnerable? Did you ever feel vulnerable? And did you find it difficult when you couldn't or make all the decisions on behalf of your loved one? And Colin, if we can jump to you first, please.
Yeah, I mean, when it comes to vulnerability, I think, Michael's oncologist would look at me, probably the first time he met me, looked at me and said, I don't know if you understand what's going on, because I was in there making jokes, trying to get my brother to laugh, when he first was told he had cancer. That was just our relationship. And so, I don't know if he saw, the vulnerability was the first thing, but it was, I commend my mom for this all the time, where she was out with my brother. She told me to come out there once they heard what the diagnosis was going to be, because it was, Michael's going to hear maybe nothing in this appointment. I might hear some things, you might hear some things, but we can take a team mentality to this, kind of to be able to, hear what we can. And, so that was kind of step one, to realize, okay, like I have to do my part. I have to listen, but I also have to understand, how I treated at the beginning was I have to be myself and the relationship I have with my brother, and I have to honor that. And so that's what I tried to do. So I came in, the more I get to know people, the more my sarcasm comes out in that relationship. So you can imagine my brother and I have been best friends our whole life. There's a lot of it. And so I tried to make him smile and laugh and have a little bit of a break in what was a heavy environment at the time. But I think, the hardest thing for me was, my brother and I have always been inseparable. Even when we left for college, I never thought we were going to go the same place the same year, but he ended up transferring out the year I came out as a freshman. And him and I just truly were always together, high school, college. And so the balance of trying to understand, how do I get that personality back from him? I was feeling a loss. My vulnerability started coming out the more I was like, how do I get that back? How, I can't control what he wants. I would try and tell him, hey, we got to get outside. You got to get out and move because you just start falling deeper and deeper into a depression right now that I don't understand. So my way is trying to pull him up. And it took a lot of time and a lot of practice and a lot of grace from him and vice versa from me, in which, we had to be able to get a feeling of, okay, where's that balance? How do we push the right buttons? When do I know not to push? But it was a challenge. I constantly was trying, again, that emotional support is where I feel like I came in and trying to get his personality to come through and find the joy in life. And so I really, it was a challenge, but it was very hard to be able to sit there and not be able to get him to get up, get a break, get out of his chair when I knew physically he got to the point when he could, but he didn't want to. And it's like, you can't force anyone to do anything. So you try and find different ways to support. And so it was definitely a roller coaster of a journey, but it's one of those things that still to today, it's 14, 15 years later, there's still little hiccups on the road when it comes to communication and that vulnerability comes out. How do I find the right way to support? But you just got to try and take a step back, listen, and do what the best you can.
Thank you, Colin. And Nancy, obviously, the perspective from a mother's point of view would be wonderful to hear.
So I have to share that when I was 19, I was told that I had cancer, and I didn't. But talk about putting me into my own tailspin. And I always kind of live with that in the back of my head, going for the checkups, and making sure, and that's never happened. So when my son was diagnosed with cancer, the vulnerability was, for me personally, he walked out of an ultrasound, looked at me and said, I have cancer and we're not going to cry about it. And that's what he needed me to do. I'm his mom. I am going to do whatever my kids, and here he was directly telling me what I needed to do or not do. I did not cry for 2 years. As a caregiver, I will tell you, I have heard it many, many times now, you're taking care of your loved one. In this case, I'm taking care of Michael. Now I feel like I have a huge family at Epic Experience where I continue to help where I can and sometimes advocate for them when they're not feeling well enough to advocate for themselves, because not everyone has a family, a mom, a friend that is going to help them. So watching Michael go through this, Colin put it very well. We're a pretty tight-knit family, don't have a big family. There's 5 of us, it's growing. There's now 8 of us. But I think that vulnerability, that is what Michael needed me to do, was not cry. And he knew, and I think it took me back to that 19-year-old self when I was petrified and I laid in bed for 3 days because I could not call my mother because she had taken a drug when she was pregnant with me so she wouldn't miscarriage. So now that's flashing into my mind. Is that causing my son's cancer? So it was a whirlwind of emotions, guilt. Did somehow what my mom gave me cause this? And again, this isn't supposed to happen. And just being that advocate for him. He was 23 years old. And, everybody's different, right? And I would say, honestly, I would describe Michael, and I think most people, when you're told you have cancer, he was shell-shocked. He almost couldn't speak. When we sat in that room and I called, my husband was in Texas. I had flown out to Colorado. We were living in California at the time. And when I called Colin, my husband, stopped, got out of a meeting, flew home, and we were all there. But to watch, and it's really one of the toughest things, there's nothing I can do. I have no control except to try and be there and love my son and help him make decisions. And sometimes that means speaking up for him.
Thank you, Nancy. So we're now going to move on to our next discussion topic. I'm actually going to come straight back to you, Nancy. What I'd like to go into now is the four of you are all representatives or members of movements that support patients and carers in one way or another. What I'd like to think about is, where did you find your greatest support? You know, who was on your team? Where did you get that insight that helped you advocate for yourself or your loved ones? So what people, organizations did you find the greatest comfort in? And Nancy, not to put you under pressure, we're going to go straight back to you.
No pressure, Gary. I would say, first of all, we were lucky enough. We were at University of Colorado Cancer Center with a most amazing doctor who had just trained with the world's best, Dr. Einhorn in Indiana. And I can't remember who, one of the nurses or social workers said, go down and get the Live Strong book. And I did. And that was a godsend, because we had just 6 months before gone through a benign brain tumor where Michael's in the ICU. He didn't have a skull drilled into. So that was kind of a little bit of a lesson in a little bit more advocating and speaking up. Sorry, dog's ball is under the table. And so that was a wonderful thing for somebody to just say that. And I think now there's so much more that is shared. And there are a lot of resources, but not everywhere. It's interesting in the United States. I mean, we're a national nonprofit, and I can tell you there are areas of the country that are far and away leading the charge in survivorship and mental health, and acknowledging that cancer does not end when your treatment does. It never goes away. And people want to believe it does. But I think as far as my strength, I lost friends. We had very dear friends walk away. I don't know what their problem was, but that's okay. But we had other people step up. But because I think Michael asked me not to cry about it, I was pretty stoic. My husband and I, we were mission on, we were there for every appointment. We didn't even necessarily talk about it. It was head down. What do we need to do for Michael? Not the best way to take care of myself, I can tell you that. So I'm not the best example of what to do for how I handled it in the beginning, but all I cared about was my son making it and his life moving on.
Thank you, Nancy. I'm just conscious of time, so you might have to pick it up a little bit, but Colin, obviously being in a college setting, what organizations or institutes do you find supporting?
Well, in Denver, Colorado, right outside, there's a brewery called Court. No, I'm just kidding. So really, for myself, I didn't know. I mean, in college, kind of, all of our friends, they were, like I said, they were going into their professional careers, all this. We didn't know where to turn. And it wasn't until, my brother went to a Stupid Cancer meetup. And that was the first time I ever, met someone that was, I went with them. First time I ever met someone that was a caregiver. No offense to anyone out there or ages, but it wasn't, it wasn't to a grandparent or something like that. That was a peer to me. That was to, someone around my age. And so it gave me the opportunity to realize it's okay for me to talk about what's going on with myself. And I always felt I couldn't do that. I always felt it's not about me. It's about, my brother, and it's about supporting him. And why do people ask if I'm doing okay? Because I'm fine. I don't have cancer. I don't have any health issues. I don't, I can keep, picking up more hours at work to try and get him out to have go out for beers to get out of the house or whatever it would take, to pay for those things. But I just never thought it was about me. And so that was really, a great experience for me, my first meetup where I was around the cancer community. And it's honestly a big reason why I ended up working now in the cancer space full time, because of the fact that I fell in love with the community. It's no BS, right? People want to be real after something like cancer comes in, and you just want to find genuine relationships. And that's what I found. And so, that's really the big thing for me, was just that first meetup. Then I went on some other programs with just caregivers and realized it's okay to, share what you're feeling as well. and you have the opportunity and should have the grace to be able to share that.
Thank you, Colin. And Kelly, jumping to the patient experience, and obviously your journey being of what it is and such a long one as well, where what organizations and support have benefited you really?
It has been a long road. So my relationship to all of it has changed so many times. But basically for the first, I would say 15 years, what I did was completely segregate the experience that I had in an oncology, in an infusion ward with what I thought of then as my real life. That changes quickly, but because since I've been in treatment basically for 23 years, I separated them so starkly that I did not walk into a support group until I was in Washington, DC. There's a friend of mine actually on watching from there, until Washington, DC in about 2018, 2017. The feeling of walking into a room where I did not have to explain why I was bald, why I was limping, why I didn't own a home, why I didn't have a 401k was one of the most amazing experiences I've ever had. And then from there, I went to Stupid Cancer in Denver in 2018, and I cannot wait to get back. But I can't describe walking into a room where people just know that, oh, excuse me, I'm going to have to projectile vomit for a second. Could you, I don't regret not doing it until, 18 years in or whatever, but it was pretty special to do that.
Thank you, Kelly. Megan Claire, the same question.
Okay, well, I didn't find out about a lot of organizations and or that additional support until the survivorship stage, but I read every piece of paper that I was given when I originally got diagnosed, and my social worker told me about this one local organization. It was instrumental, and it was the first time I'd ever met any cancer patients. It's called Camouflage, and I took this class 2 weeks before I started chemo, and I learned so much. And I also met who I affectionately call my chemo twin. Her name is Erin. She was 3 months. She had been diagnosed 3 months ahead of me. And so when we met each other, we were the same age, same height. We had the same sneakers on. Like, it was just like, oh my gosh. And she was the first person I ever saw my age bald, because she had already lost her hair. And I remember that moment because you have to drink so much water when you're on chemo. And we had gone to the restroom and she took off her scarf, and I just remember thinking, oh my God, that's gonna be me like next week. And I just had a full-on meltdown, and it was so lovely that it was just an instant connection. And that's what you find in the cancer community, like these deep connections instantly. But then once I made it, to the other side, I did find like one local group called Young Adult Cancer in Atlanta, but unfortunately they don't meet anymore. But it was really great the first time I got to meet others my age, because I didn't know about stupid cancer at the time. And it was to not have to explain anything, to just be, and it was okay to be fatigued and not have to tell someone why, or the weight, like not be self-conscious about how I look, my weight or whatever. That was really huge to me. And for me, I think of self-advocacy means finding some sort of control in a chaotic situation. And so I was able to figure out, you know what, another way to self-advocate for myself is I need to write this out. I have so much in me. I've just been in fight or flight mode for so long that even after I met some awesome people at Digital Cancer Con, because I've never been to it in person, I hope to get to that one in person. But I took this awesome writing class with Cactus Cancer Society, formerly Lacuna Loft, called Unspoken Ink. And it was the first time I'd ever written about it and then like read it out loud, my thoughts. And I was like, whoa, that's when I realized I actually had a lot of anger going on. But it was really huge for me, and finding that connection and that support. And I knew that I needed it because I was like, at the end of the day, cancer is big. It's bigger than you. Like you cannot go through it 100% alone. You've got to lean on people. And it really helped me let go of my pride, but also form some really important and deep and beautiful friendships along the way.
Thank you, Megan Claire, and thank you all. So on to our next discussion. I'm interested to hear about some of the routines, the behaviors, the techniques, the habits that you adopted that really supported your self-advocacy or supported your advocacy for a loved one. So if you can jump to Kelly to kick us off on this one, some of your habits, deepest and darkest habits.
So I'm at a point in my treatment, and I just did 2 years straight weekly IV chemo, and I've been sleeping since then, basically. My route, I actually at this point in my treatment and with my doctors, I tell them, this is your world. You're the expert here. You figure it out. You tell me what to do. That's where I am right now. When I was younger, I did a little bit more research, which was difficult in 1999, and read up. But these days, I am not interested at all in my disease. I am keeping it separate from my life in many ways. I don't ever write anything down. I don't ever record anything. I have a type of tumor that maybe we think 50 people a year are diagnosed with. So nobody really knows anything about it. So they're learning from me. So really they're the ones taking notes. And I've been very proud to be in 3 different clinical trials, and have had an experimental surgery done on me by my beloved surgeon. I kind of go with the flow these days. We just try and figure out as we go along. We don't know. I just did a phase 1 chemo. I was the 10th person on earth to get the drug. It's this at this level when you're at Dana-Farber, when you're at Sloan Kettering, it's kind of a different experience. And in a situation where the rarity of your disease is so prominent in that room, they're really learning from me. And I have been honored to have been studied by some of them, couple of them. Some of them I don't care for, but a couple of them I really do dedicate my clinical trial experiences to them and let them know that I'm doing this for them.
Thank you, Kelly.
You bet.
Megan Claire, it sounds like writing's one of your techniques or habits.
It is. It's so crazy that I never even thought of myself as a writer as I, look at my almost 32 journals in my closet. But anywho, one of the things aside from writing for me is there's a limited time that you have with your providers, whether you're newly diagnosed, after treatment, the so-called survivorship stage, wherever you are. And so one of the things I do is I write out. As a writer, I gotta write everything out I do. Like my top 5 questions, but then I list the top 2 to 3 most urgent ones, like the ones I'm not leaving until I get some sort of answer, solution, direction, something. And then I leave the others, okay, I can just, send a message through the portal. But then I also, because I am really sensitive to side effects post-cancer, and I really need my doctors to think outside the box, and some of them have not. And I'll come in with the latest research because I want to know more about, what can we do to help me? Because I really want to improve my quality of life. And having lobular breast cancer, it's definitely underfunded. And so I'm always reading up on stuff, and now I have all these chronic health issues. And so I'll bring in some research from a reputable, medical journal, website or whatever. And some of the doctors will actually get offended. And I have to just really stand up for myself and, because they try and dismiss it. And I was like, this wasn't just some random Google search. This is from a reputable medical journal. And, can I suggest that you talk with a colleague and, have them talk, because I really want to try this medication. I just have to always think of myself first and be my life matters in this moment. And if you're not going to listen to me, then I'm going to find someone else. who will. So those are like some of the key things that I do to help keep things moving and going.
Thank you, Megan Claire. Colin, some of your techniques and habits that have helped you or your brother through his cancer journey and yours.
Yeah, I think, I always say I live by two mottos in my life that I try and tell myself, that is, life is perspective, and I'll say it the PG way, diversify your stuff. But what I mean by that is the biggest thing for me that I think helped was realizing that, there are certain people that you can talk to about certain things. And it gets very heavy for those that you care about, those that you're loving for, your family, whoever that is, a partner, to give all of your, emotions to that one person. It's a lot. And I think for me, I really tried to start targeting who is the person that can relate to me on that topic. And what I mean by that was, once I met another caregiver, shout out to Dan, who, is kind of my go-to guy, who caregivers for his wife. It really helped me a lot. I go to him, I can't go to my family about my brother a lot of times, there's certain maybe frustrations I'm having because we're all in that same boat, right? So I go to someone else and I share their boat and I talk to them and I say, okay, here's what I got going on. Here's the dynamics at play here, and it just gives you a sense of ease to go, okay, one, I can relate to him on where we're at a lot more than I can relate to where my parents are in their caregiving journey, a lot more to where my brother is in his journey. And so I really encourage you to find that community in which you can find that person that relates, free of judgment. It's a separate spot, a separate bucket that you can talk to them about whatever it is going on. So that's really important. And the last thing is just realizing, at least for myself, I know my mom and I don't necessarily agree on this one, but finding time for yourself and realizing it's okay. My big thing, as you see the picture behind me, golf is my vice to get out and be able to clear my head. Realize I can go play a par 3 course for an hour and 15 minutes, get him what he needs before I leave, and it will be okay. He will be okay in that time. And realizing every once in a while you need to do that for yourself, or go for a walk, or whatever it is. And so that's my biggest thing, is realizing, hey, talk to them before you leave, set them up, whatever they might need, have a conversation. But at the same time, it's okay to take a little bit of time for yourself, for your own mental health and self-care.
Thank you, Colin. Nancy.
I agree 100% with Colin, and he is absolutely correct. We're a little different on that. And part of it I would blame for me on PTSD, because when I first got the phone call when Michael had his brain tumor, it was a phone call. Then all of a sudden, 6 months later, he's graduating from college, and he said, "Mom, I feel this lump." And he's like, "Oh, it went away." And then all of a sudden he calls and it's like, it's going to come. And it kept, things kept happening. It was every time that phone rang. And I still, 14 years later, if my kids call me because something happened to one of my other kids, not Colin, to our daughter, and our phone was off. And so that taking care of myself, it's tough. It is very tough to find that. I've tried, I love horseback riding. I love animals. I've leased a horse. Do I get to see her very often? No. I'm getting over who knows if it's COVID or whatnot right now, but it is so important to take care of yourself. I am not the best example. I will be 500% honest. I love when we have our in-person camps, and I think the last 2 years have been exceedingly hard for people, for caregivers who can't go to an appointment with their loved one who has cancer, and the patient being in there and they're by themselves. What a terrible scenario. I mean, there's nothing good about that. So, yeah, I would PTSD is a real thing. And I definitely, for me, it's when the phone rings, and it still happens. Just a little bit of my heart jumps, and that's not a good thing. And somehow, someday, I hope it'll ease up.
Thank you, Nancy. So I don't throw you, we're just going to skip our next topic and jump straight to our last discussion on validation. So I don't want to throw you, but we've heard very eloquently put over the last hour that, through seeking alternative approaches to care, validating decisions that have been put upon you, isn't necessarily an aggressive stance to take. It's about finding the appropriate treatment, care, support that you need or your loved one needs that's personal to them. So as we do sort of draw a close to this this session, I'd love to hear from you, what your takeaways are in terms of what you've learned from your experiences that have helped make your care successful. And if we can go to Meg and Claire to start that would be wonderful. Sorry, Meg and Claire.
No problem. My final thoughts would be this. Advocating for yourself does not mean that you are arrogant or aggressive. It really is about trusting your intuition when something the doctor says just doesn't sit right with you, and questioning that. And I really, really hope that more patients will stop worrying about their doctors liking them or not. That's often why many won't get a second opinion, because they're like, oh, then my doctor won't like me. I'm like, this is your life. This isn't about them liking you or not. Like, they best do their job in keeping you alive. And so my accent's coming out. I can hear it. I think that muscle relaxer's kicking in. Sorry. But it's really finding something that you can control in that chaos, something that you can do for yourself that no one else can tell you what to do, because so many decisions are so big and you have to weigh in all of these different inputs. But more importantly, it's really about trusting yourself, because when you start to advocate for yourself, you're trusting that instinct that something doesn't sit right. And I hope more patients will start to do that.
Thank you, Meg and Claire. Kelly.
My disease has touched every part of my life in certain ways, even though I do tell you I separate things. It's the reason that I got into politics, and to make sure that people had health care. And I will work for that for the rest of my life. One of my oncologists told me that my job on Capitol Hill sounded stressful. And I looked at him and said, you have had to tell me that I'm going to die. That's so interesting that because I find that sitting in that clinic is the most political thing I've ever done. The politics are so, you have to be aware of every single thing going on. It has shaped me and helped me professionally to be able to deal with doctors. I learned as a child how to deal with adults on a level that is life or death. And I have never been a shy person, and the fact that I have lived through this 23 years of treatment, 9 years of chemo, 3 experimental chemotherapies, 3 debilitating and disabling surgeries. And I am so proud and so happy and grateful. And I take that into every doctor's appointment with me, and that I made it and I'm still here. So I hope everyone feels the empowerment and understanding and doesn't fear speaking up for themselves, because this is your body, and what they're doing to you hurts you forever. So you have to be more than okay with it. And the relationship with your doctor is unique. Your oncologist is unique. It is always truthful, and it is, of course, is sacred. And as Megan Claire was saying, she fired her oncologist, which is one of the most empowering things you can do sometimes. But never, ever hesitate to make sure that you are okay and whole in that setting. It is the power dynamic is crazy. You remember that you are the center and you are the only one who gives permission and makes decisions. It is you, and you lean on your people like Nancy and Colin. You lean on your family and your friends, but you can do it. You can get through it. We are proof, and it sucks, and it will drive you insane. It will make you sit in a chair for a year, as Colin said, but you can do it. You can get through it, and always make sure that you are okay with what's happening.
Thank you, Kelly. Colin.
I think, if there's anything I can kind of leave with, it would be that, communication is a constant struggle. Much like, you hear cancer, once you're diagnosed with cancer, it's with you for the rest of your life. Many feel that way. Some maybe don't. That's for everybody to deal with themselves. But I think it's important to find out how to communicate. Again, one thing my mom always said was, to Michael, we don't know how you feel. You know how you feel. We're thinking 100 different things of how you feel. That's where communication is key. So any of you that are survivors or, an advocacy space to be able to help support one of those, make sure you try and, inform people. An open line of communication with your caregivers is very important to make sure that you're on the best same page as you can be. It's not always easy, but hey, let them know how you're feeling, because they might be thinking their own things that you don't know about. But having that open dialogue, whether it's through written word, which I had leveraged in the past, kind of saying, this is how I'm feeling, this is what I'm thinking, whether it's through conversations, find that way it works for you, but really try and make sure that your communication is the best it can be in a time when it's not easy. But allow each other the grace to get frustrated, get mad, but come back to the place of, what, we're both here for the same reason, and that is to make sure that our lives are moving on in a positive and healthy manner the best they can.
Thank you, Colin. And last but not least, Nancy.
Yeah, exactly what Colin said. But I remember Michael saying to me, I said, you can tell me anything. He said, no, I can't. And I said, Michael, I probably think 500 times worse of thoughts. And it is exactly that conversation of, just being willing. And it's scary to say that I'm afraid that my son is going to die is a terrible thing to think about kids and his future. And I just really want to encourage, if you want a second opinion, I mean, Michael, we got one, thank goodness he didn't have his skull, drilled into. And when his oncologist went after the first surgery, we said we wanted a second opinion. He said, I'll help set it up. That man, 15 years later, is still Michael's doctor. Michael trusts him, and he knows no matter what, he'll listen to Michael.
Thank you, Nancy. So this draws a close to this session. On behalf of the Great Health team, I'd like to thank all of you for your openness, your honesty, your transparency on what are very, very personal journeys and experiences that you shared beautifully with our audience today. So thank you, the four of you. And as we do close, just some final remarks. Please, those that are still here, go to the Advocacy Exchange website to find out about our next session, which is on the 3rd of March. And should you have any questions, I'm sure the Grit Health team will share details and further information with you about our panelists, some of their activities, and anything else you need. So thank you, everyone, and stay safe, and hope to see you all soon.